McNutt, producing and presenting my Capstone and 5-year plan presentation. My name is Jeff McNutt. I am a registered nurse in the state of Texas. My current role is that of in critical care at a level 2 trauma center in our step-down unit, also known as IMC, intermediate care. I am ACLS certified, and I have also taken the course in advanced trauma nursing. My healthcare education is that I received my associate's degree in nursing from Austin Community College, and I'm currently enrolled in the Lamar University RN to BSN program, and I anticipate graduation in December of 2018. Previous healthcare employment experience, I worked as a home health CNA, and I was also a certified EMT. My previous employment experience prior to healthcare was I was an engineering project manager at Dell, and I was a manufacturing manager at Applied Materials, and I was also a commissioned officer in the United States Marine Corps. Today we're going to be discussing the learning outcome objectives of this program and how they were achieved with the classes that we took. Learning Outcome 1 practices safe and effective holistic patient-centered care to a variety of patient clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. We achieved that in this program through the classes of Comprehensive Holistic Health Assessment, in which we wrote activity papers. One of them was on the National Project of Healthy People 2020. There was also an activity paper on the nursing process format. And we had various discussion boards on multiple assessments and educational situations. In the class, Practice Comprehensive Multiple Health Care States, we did presentations on community relevant healthcare state. I did mine on prostate cancer and how it impacts people. We did a reflection paper. I did mine on type 2 diabetes, and we also created a care plan for the same condition, in my case diabetes. We wrote a second reflection paper on theory-based advocacy and goals, on how we would use a nursing theory for patient advocacy. And we also, in this class, had various discussion topics on complex health states. And then lastly, for this learning outcome, we took a nursing theories and online education course. We produced a paper on our favorite nursing theory. Mine was Florence Nightingale's nursing theory. We did a focus insight paper on applying nursing theories to real-world scenarios, and I did a scope of practice paper on a BSN nurse versus an ADN nurse. I felt this learning outcome was met 100%. Learning outcomes 2 and 3: support patient-client in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. Also, evaluate patient-centered care for patients-client across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple determinants of health. Once again, I thought the nursing theories and online education class participated in meeting this outcome. Again, we did the paper on Nightingale, BSN versus ADN, and applying nursing theories. And again, the Comprehensive Multiple Health State class, where I did my papers on my presentation on prostate cancer, my papers on diabetes, my care plan for diabetes, my paper on theory-based advocacy and goals, and various discussion topics throughout the course. And finally, a different course for these outcomes was our Leadership Management Healthcare Systems class, where I created a presentation on the International Council of Nurses, and did a paper on the art of leadership, the good leader versus the bad leader, and a research paper on current hospital alarms and their use that I titled The Silent Den. I felt this outcome was also met at 100%. Learning Outcome 4 synthesizes clinical and judgments in nursing practice utilizing critical thinking, nursing process research, and evidence-based practice. I felt this learning outcome was addressed again by our Comprehensive Multiple Health States class, which I won't go through again the details of the prostate cancer presentation, diabetes, the plan for diabetes, and theory-based advocacy. I felt the nursing inquiry evidence-based practice class applied to this outcome, where we did a qualitative research review assessing floor nurse communication skills, We also did database search activities and quantitative research article activities to introduce us to various research quality objectives. We did multiple worksheets on research lexicon and definitions, and we did a major discussion on research ethics. Finally, the class I think that contributed to this as well was our practice care of communities. In care of communities, I did a presentation on civic pride, the Round Rock Serving Center, and our practicum on community survey and evacuation planning. I felt learning outcome 4 was addressed up to 90% in this program. Learning outcome 5, employs safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients and clients and members of the interprofessional and intraprofessional healthcare team. Again, I thought nursing theories and online education contributed to this outcome. I thought nursing inquiry, evidence-based practice contributed to this, where again I did my qualitative research review on assessing floor nurse communication skills. We did a database search activity, quantitative research article activity, and various research in lexicon and definition worksheet activities, and our discussion topic of ethics. And then also I thought that our leadership and management healthcare systems class contributed to this outcome with its presentation on the International Council of Nurses, paper on art of leadership and the good leader versus the bad leader, and the research paper on current hospital alarms. This outcome I felt was met at 100%. Learning output 6 and 7, differentiate multiple role dimensions practices with ethical, legal, and regulatory parameters when caring for patients, clients as a member of the interprofessional and intraprofessional healthcare team. Also demonstrates professional integrity, effective communication, active inquiry, and service to the community. I think our Care for Communities class went a long way to answering this outcome, as well as our leadership class that I have addressed before. However, I felt this outcome was only met at about 80%. Finally, my 5-year plan. I intend to obtain my Bachelor's of Nursing by December 2018. Then I will focus on completing my current 24-month work contract at the hospital where I'm working. At that point, I am going to begin a professional search for a new nursing position in a different part of the country. I'm going to focus on the Rocky Mountains and the Pacific Northwest, and that'll happen in the second half of 2019. I will then transition geographically to what I am assuming right now will be another critical care position up in that northern northwest region by around 2020. And then I will complete at least 18 months in that new position, which I feel someone should do when they come to a new position. They should give at least 18 months. And then I will transition to what has always been my long-term professional goal, which is to get into hospice care, preferably in the home health environment. And then after I achieve that, I will have to take a survey of my grandchild population, because my wife tells me we are going to move to wherever grandchildren are present. So that is the Jeff McNutt 5-year professional plan.